If you're dealing with sciatica, you know how frustrating it can be. Pain in the low back, glutes, or down the leg can make everyday movements and getting around every day that much more difficult. But sometimes the biggest problem isn't the condition itself, it's trying to find ways to move that don't keep re-aggravating your problem. Today, I'm going to walk you through 5 common mistakes that can make sciatica worse and what you can do starting today. Sciatica usually means irritation of the sciatic nerve. You know that one traveling from your low back down your leg? This irritation often comes from disc pressure, tight glutes and or piriformis muscle, and or poor load sharing through the hips and the spine. The goal is reducing irritation and helping to restore movement, not shutting down activity completely. Because you'll realize throughout this video how important it is to move to help your body thrive and stay healthy. Hi, I'm Dr. Matt Bradbury, family corrective chiropractor, and here we are at One Life Family Chiropractic here in Georgetown, Ontario, Canada. Today I'm going to be talking about 5 mistakes that may be making your sciatica worse and what you can do starting today. Of course, if you're just tuning in, I love having you. I love sharing the message and interacting with you. So take a moment, make sure you subscribe and like so we can interact some more and I can help you along your health journey. Mistake number 1 is too much sitting. Remember, sitting often compresses the lumbar discs, puts more load through the back, and it keeps the hips flexed and the glutes inactive. And often those hip flexors are becoming shorter and more tight. Over time, this position and you practicing this for those 30 to 40 hours a week may increase nerve irritation and lead to compensation in your spine. So what to do instead? You have to be up moving around, first of all, every 20 to 30 minutes. And yes, these short walking breaks would be of great benefit. You standing up, simply walking to the water cooler would be a simple way to break up your day and take a load off of your spine. Mistake number 2, aggressively stretching. Remember, your hamstrings, your low back, your tissues may not like that aggressive tension. So that's one thing you want to avoid, especially those positions of deep flexion just like this. So I'm going to show you a better way that you can do that right now. First of all, when you're stretching, I want you to take a moment just to gently lean forward like this. And you'll notice I'm keeping, my torso more or less straight and I'm hinging at my hips just until I feel that tension in the back of the hamstring. What you're going to do here is actually just hold this for 20 to 30 seconds, breathe, and then you're going to back off, stand up tall, and you're going to repeat that 2 to 3 times. And just be really gentle about it, focusing on feeling the tension in the back of your legs and hinging at your hips, not rounding out your low back. And some other gentle hip mobility would be just like this. Torso upright, leaning over, elbow on my knee, putting some pressure down, really opening up that hip into external rotation, which you may find really useful in terms of stretching your glutes, opening up your hip into positions you may not get in throughout the day, and things you can simply do to improve your hip mobility. Mistake number 3, avoiding movement completely. Now, hey, maybe it feels logical to stop doing things altogether, but guess what? If you stop, you begin to rust more. So relative rest is important. So it's important that you keep moving and find a way to keep yourself going strong. Remember, movement often improves circulation and helps with nerve sensitivity. So you moving literally helps change your brain and helps with the healing process. So what's a better strategy? Well, first of all, you taking a break and going on some short walks would be ideal. Movement is key and applying periods of relative rest. If you're trying to do something at 100%, that may not be possible right now. So instead, reset your expectations. And what you may be doing is working at 60, 70% of where you were before. If you like walking 2 miles, go for 1.5 miles. If you like working out at the gym, show up for 45 minutes if you're used to showing up for 60 minutes. If you're used to lifting 100 pounds, show up, lift 50, 60, 70 pounds. Start building yourself up gradually. Keep yourself moving, gently reintroducing more activity progressively. Mistake number 4, ignoring glute function. Weak or poorly coordinated glutes can contribute to this situation overall in terms of your movement pattern and how you're going to optimize your healing. So some simple things to consider starting today. Yes, bird dogs like this would be useful. You'll notice with this one, I'm going to do 6 to 8 reps on one side, and then I'll switch sides, paying close attention not to let my hips shift side to side. And yes, side planks, working on your core stability, your hip strength will be useful. You can even add in a hip drop just like this, where you're working to use your small hip muscles again and retrain your movement pattern, working in, well, 10 to 15 reps per side for at least 2 sets. Most people wait too long until symptoms flare up really big. And guess what? My analogy is always, hey, think about it this way. If the fire alarms went off and the sprinkler system was going, what's the first problem? The fire. By the time the sprinkler and the smoke alarms are going off, there's already been some sort of fire going. So guess what? If you're proactive and look after yourself ahead of time and do those small things, and many people, well, guess what? They add corrective chiropractic care into their life as a proactive strategy to help them be more resilient and bounce back quicker. So those small routines outside of the office and those simple routines here in the office can really be a benefit to help you keep you on your game, help you heal, and help you perform how you want. Which brings us to our next point as we finish up today and include those proactive things you can do for yourself to get back on track. The health of your spine and your nervous system. And yes, most people have never had corrective chiropractic simply explained to them. And yes, your spine has to move, your brain has to communicate with the rest of your body. That includes your muscles, your organs, and those nerves help with how you heal. If your spine doesn't move properly and the nerves are irritated, that's exactly what your corrective chiropractor looks for. So i.e., yes, some things may be uncomfortable, but some things you may have no idea about until you get tested and start to understand that you're compensating above and below, which may be leading to challenges through here and contributing factors. So consider the health of your whole spine and nervous system, and remember those 5 simple mistakes you may be making that you can turn around starting today. Of course, don't wait. That last point, mistake number 5, is waiting too long. So let's get back on track together. Remember, sciatica can be frustrating, but the right strategies make a big difference. Avoid these 5 mistakes to help keep you at your best. And so whether you're a mom, dad, busy person altogether, you can keep yourself being more resilient, proactive, and reduce the amount of downtime you may have had in the past. If you found this helpful, please take a moment. Make sure you subscribe, like, for more simple strategies in the future that can help you be healthier and keep you on the right track. Anyways, remember, you're far stronger, more resilient, and resourceful than you may have led to believe. Bye for now.